Hello everyone, I'm Dr. Ho-Sung Choi from South Korea. It's very happy to meet you online. Today I will talk about how to smooth deep forehead lines and about easy and effective wrinkle fighting tips. Could you show me next slide, please? Okay. First of all, we need to classify forehead lines according to a certain criteria. This is because therapeutic approaches vary depending on these classifications. There are two types of forehead lines. Dynamic forehead lines represent lines that are visible only when the frontalis muscle is contracted. However, the static forehead lines represent lines that are visible at rest, even when the frontalis is relaxed. With repeated use of the muscle to form the same expression over a number of years, dynamic lines become static lines. Long-term treatment with botulinum toxin can prevent the development of imprinted facial static lines, including forehead lines. This is a famous study on twin sisters over a period of 13 years. One who used botulinum toxin regularly and one who had minimal treatment. Concluded that botulinum toxin is significantly effective in preventing the formation of static lines and wrinkles. The twin on the right, had treatment 2 or 3 times a year to her forehead for 13 years. The twin on the left received botulinum toxin injection only 2 times in her forehead. The results speak for themselves. The twin on the left has clearly visible static lines. However, the twin on the right has much smoother and more useful skin. Botulinum toxin is obviously highly effective on active lines because it relaxes the muscles that cause them. Forehead lines can also be graded by their severity. This scale of forehead lines is quite useful when making assessment of the treatment of the forehead lines treatment. Personally, I prefer to use a more clinical classification like these photos, depending on the depth of the forehead line. The deeper the forehead lines, the more treatments you will need. Forehead lines can also be distinguished by whether the contour of the forehead is convex or concave, as the treatment methods may vary. If the forehead is convex, like this forehead, most forehead lines are fine and shallow, so they can be easily corrected by only filler injections. On the other hand, if the forehead is concave, forehead lines are usually wider and deeper, but the number of lines are usually smaller. To achieve better results, it would be better to correct this concavity first by injecting HA filler into the deep layer before correcting forehead lines. and then you will have a better result. These are available treatment modalities for forehead lines. These 5 methods are what I commonly use. And in almost all cases, 2 or more of these treatments are combined to treat forehead lines. At this time, I'll focus on PDO thread insertion and filler injection. Sorry. Okay, let's look into the PDO thread insertion first. Currently, there are many kinds of PDO threads on the market in Korea. Each product has a different purpose and indication. When it comes to the correction of forehead lines, especially deep folds, a braided PDO thread named N-scaffold is the most useful and is the most famous in Korea. Basically, a braided PDO thread consists of multiple fine PDO monofilaments in a twisted form so as to lift the soft tissue acting as a scaffold. N-scaffold is the most popular braided PDO thread in Korea. It is made with 12 fine threads in a single braid which is folded in the middle. So inserting one single N-scaffold means inserting 24 threads at once. The cannula is a half-cut type or L type, which is safe and useful for dissecting the fibrous tissue beneath the fold. Among 3 types of N-scaffold, these 2 types are the most widely used clinically. Since the thread is folded in the middle, the actual length of the thread will be about 3 centimeters and 4.5 centimeters, respectively. After the N-scaffold is inserted into the tissue, foreign body reaction that activates inflammatory phase, including hypersynthesis of collagen, begins. Synthesized collagen forms an extracellular matrix and artificial scaffold complex, which offer numerous attachments of regenerative cells. Eventually, the N-scaffold acts as a solid filler, providing a filling effect of the soft tissue. As you see in this photo, N-scaffold doesn't change its shape after being inserted into the subcutaneous tissue layer, which means we can predict that N-scaffold will function properly in vivo. Also, various injectables can be combined with N-scaffold, like HA filler or PRP, to increase growth factors and cytokine release. Eventually, abundant collagen around N-scaffold will mechanically support the folded area upward, so it can provide some volumizing effect. Since N-scaffold has the ability to play as a role of a solid filler, it can be applied to correct the following changes, such as deep folds, deep forehead wrinkles, glabellar front lines, and also tear trough, and nasolabial folds, Marriott lines, jawline distortion, and also it can be applied for the neckline correction. Before starting the treatment, it is very important to design properly, including precise measurement of the length. In most cases, I use N scaffold with 9 centimeters long for the correction of forehead lines. As I mentioned earlier, the length of folded braided threads is roughly 4 centimeters. So, after targeting a 4 centimeters long fold, the entry point should be marked 2 centimeters away from the fold because the length of the cannula is 6 centimeters. The appropriate insertion depth of the cannula is the immediate subdermal layer. That means when you advance the cannula, you should feel some scratching the bottom of the dermis. The cannula should be advanced gently, maintaining the same depth. Since the fibrous is just beneath the fold, in most cases, a gentle dissection using the cannula will, while advancing it, will not only improve the fold itself, but also help to create a space for the thread to be inserted. And remove the cannula carefully while pressing down the end of the cannula with your finger of your another hand to prevent the thread from escaping out of the skin. Okay, this is a video that is showing N scaffold insertion technique. As I said earlier, I'm measuring the length precisely, 4 or 4.5 centimeters of length of the fold or line, and 2 centimeters apart, I'm injecting lidocaine at the entry point. Puncture using 18 gauge needle. There could be some bleeding, but you only have to compress for 1 or 2 minutes. And then this is N scaffold. It is very important to keep the same depth during advancing your cannula. And also, if you feel some fibrous tissue beneath this fold, and it's better to dissect gently using the cannula. As the cannula is L-type, half-cut type, it's quite easy to dissect safely. Once the advancement is completed, as you see here, I'm pressing the end of the cannula while removing the cannula. And if there's some bleeding, you only have to compress for a while. And another insertion, the same process. As you see here, I'm feeling some difficulties in advancing because of the fibrosis. But if you twist a little, then it would be easy to dissect the tissue. See? Okay. And scaffold can provide not only a strong skin quality improvement, but also an effective tissue support and eventual volumizing for deep wrinkles or folds on the face or the neck. And it is useful when filler injection has its limitations on improving deep folds because it can compensate the weakness of filler injection. When combined with filler injections, it facilitates a more precise location on the filler, preventing its migration after the injection. Eventually, the longevity of the filler will be improved as well. Now, let's talk about filler injection for the correction of forehead lines. There are two different types of filler injection method for the forehead rejuvenation. Vertical deep bolus injection method is to give a little volume to the forehead, especially when the forehead is concave. Intradermal injection method is only to improve forehead lines. If the forehead lines are accompanied by the concavity of the forehead, it is advisable to use both of this method. Okay, I'll show you the vertical deep bolus injection technique before correcting fine lines or forehead lines. So he has a concavity area on the middle of the forehead. So I will inject serially, vertically, small bolus injection. Of course, I should touch the bone using my needle. And you should be aware that even if you touch the bone, you may not be that safe. So it's better to regurg before injection. And also, I usually inject 0.05 ml per point. If the deep depth is too profound, then you can inject around 0.1 ml, but I would recommend to keep the amount about 0.5. HA filler, which is available for intradermal injection, should have specific rheological properties. First, elasticity, and second, viscosity. Both rheological properties should be low in order to be easily spread after injection. However, cohesiveness should be high because cohesiveness is related to the tissue integration. So, HA filler with high cohesiveness will easily integrate with the skin tissue, leaving minimal lumps after injection. So after injection, as the highly cohesive HA filler will easily be spread, and the result will be quite natural. Basically, a linear retrograde threading injection technique and serial puncture technique are the most frequently used for intradermal injection. A blanching technique is useful for superficial lines correction. It's a technique for injecting the filler into the upper dermis. So normally you will feel some resistance when you inject the filler using this technique. However, too superficial injection is not so good. So do not inject too superficially to create a papule. If you see, as you see here, if you, after advancing your needle and you lift up the skin, you should see the white color. If you see a gray color here, then it means that the position of the needle is too superficial. So this depth is more optimal. After the injection of highly cohesive HA filler on the forehead lines, they look obviously improved. This is immediately after photo. When it comes to deep folds, filler injection method becomes more difficult or complicated because the fibrous tissue under the wrinkles is quite hard. The skin tissue cannot be lifted easily by the injected filler. So, I will introduce some injection techniques to overcome these difficulties. This is the first technique, subcision technique. This technique is undermining the fibrosis using the needle connected to the syringe before or during filler injection. So you can break the fibrosis simultaneously while injecting your filler. A bilayered injection technique means to inject two different fillers into different layers, such as deep dermal layer, and mid to upper dermal layer. This technique can provide a more secure tissue support, and I usually use two different kinds of filler. For example, medium filler and softer filler, more superficially. And then it's just like put the brick and you can make a tower. So it can provide a more secure lifting ability and support. Another injection technique for deep folds correction is a perpendicular strut injection technique. It is introduced in a paper by Dr. Mashiko in 2015. The needle is placed almost horizontally to the skin and perpendicularly to the fold, like this figure. It is inserted into the dermis for the entire half-inch needle length with the skin fully stretched using fingers. So during injection, you should keep stretching the skin using your fingers. For each strut, a very small amount of HA filler is injected, and the spacing between each strut was approximately 1 millimeter. After the release of the fingers, HA struts give supportive forces to the skin to allow it to be stretched to some extent. I often use this technique when I'm not satisfied with the results, even after using the two techniques I just mentioned. So if you want a more effective result, you can use all of these methods. So let me summarize the principles of the correction of deep folds using filler injection. The followings are my principles of the correction of forehead deep folds using filler injection. A sufficient dissection of fibrous tissue will lead to better results. If necessary, use multiple injection techniques at the same time. Combining braided PDO threads provides always a better result than the filler injection alone. And since a single treatment can make it difficult to achieve satisfactory results for deep folds, I always recommend at least 2 sessions of treatment at 1 month intervals. This is my protocol. After 2 sessions of the filler injection, 1 month apart, and then for maintaining the good result, I recommend another injection 6 months after the first injection. However, the protocol may change depending on which filler you use. So softer filler will need shorter intervals. And average HA filler amounts I use is about 1 to 2 ml per session. I'll show you another video. It's a technique for intradermal injection technique. Okay, I'm approaching almost 5 to 10 degrees from the skin surface, and I try to inject into mid-dermal layer. So you should feel some resistance when advancing your needle. And after full advancement, inject gently, very small amounts, in retrograde manner. And if you cannot see precisely the location of the fold or wrinkle, You just have to squeeze the skin to find the location of the wrinkle. And during injection, I would recommend to stretch the skin. Sorry, I will continue. Okay, I'll show you again because it's very important technique. And also, if the fold is quite deep and quite wide, then inject 2 layers using 2 different kinds of filler, HA fillers, if it's necessary. And always, even if you inject intradermally, you should rigor to make sure that your needle is not intravascularly. As you see here, when you squeeze the skin, you will find easily the line. Okay. It's quite painful, so if the patient is too sensitive to pain, nerve blocking the supraorbital and supratrochlear nerve is an option to relieve the pain. Okay, after injection, I'm injecting more superficially using a softer filler. So the video doesn't work well. Okay. Okay, let me talk about the frequently combined treatments for rejuvenation, forehead rejuvenation. For synergy, I often combine the following treatments. Laser treatments can help surface rejuvenation, and also energy-based device can lift the patient's eyebrows. And also, I can use skin booster because it can also help treat forehead lines through rejuvenation of the skin surface. And also, air toxin technique is a very simple but quite effective method that I personally use often. It is to inject air first for dermal dissection, followed by dermal microbolus injection of botulinum toxin. I'll show you through the video. It's a very short video. So after putting 204 units of botulinum toxin in 0.5 ml BD syringe, and then fill in the air additionally. Then approach the needle just over the fold and advance the tip of the needle until it reaches the upper dermis, and shoot the air with very small dose of botulinum toxin. Repeat this process evenly throughout the folds. I usually use this technique just before injecting HA filler or thread insertion. So if I decide to do this technique, I use this air toxin technique firstly, and then followed by thread insertion and filler injection. So that's a usual sequence that I usually use. This photo shows that air toxin technique can also be applied for facial pores treatment. Okay, now I'll show you some before and after photos of my patients. Almost done. He's very old, so he has obvious forehead lines, deep lines. Even if he's asleep, we can see his forehead lines. Many Asians have upper eyelid ptosis because of genetic factors. For these patients, botulinum toxin injection is not available in many times. So it's better to correct these aesthetic lines by using filler injection and braided thread, period thread insertion. So I inserted maybe 4 or 5 end scaffold, including this glabella line. As it is curved, so you need to insert not straight the end scaffold. So it's it's not that difficult, but you need a gentle advancement of cannula, because you should keep the cannula along the line. Another patient, again, is a man. I'm seeing 2 deep folds and some fine lines. So I focused on these 2 deep lines using end scaffold and highly cohesive HA fillers. This is immediate after. This bends. It's not because I applied because there was some bleeding or bruising. These bends can act as a splint, because usually I inject only a small amount of small dose of botulinum toxin, or I don't inject because of the ptosis. So his muscle is still alive. It will contract strongly, even if after injection, just after injection of the filler. So too much contraction just after the treatment may lower the effect of the treatment. So this kind of bandage will help a little to keep the filler in proper position, proper location. And he has a very concave forehead and 2 obvious deep lines. So I injected, firstly, I injected using HA fillers, using vertical deep bolus injection to contour his forehead first. And then I put end scaffold for these 2 lines, and also very soft HA filler. Lastly, I injected a little, very superficially, and then you will have a very excellent result, including contouring and also line erasing. The same patient from lateral view. Because if you don't correct this concavity, the correction of the lines will be not that effective. And she has quite concave, a flat forehead, so she also wanted convexity. So I injected, like the previous one, I injected in deep layer and superficial layer as well. And she has very thick skin, but a lot of laxity, and she had some deep lines on glabella area. So I corrected these lines using end scaffold combined with HA fillers. After 3 months, the result is quite good. And this case was the worst case, because you see this line is not a line. It looks just like a scar. So this case is very difficult to correct at once. So you should inform your patients about many sessions of treatment initially. So, but after once, you can have quite good result. using PDO and HA filler combined. But I think this kind of patient will need at least 2 or 3 sessions of treatment. Not bad. Okay, this is my last slide. There's limitations of botulinum toxin for forehead wrinkles correction, especially for Asian patients, because many Asians have aesthetic wrinkles and eyebrow ptosis as well. So immediate changes in natural results you could achieve by using the techniques I mentioned earlier. Different techniques depending on the severity of wrinkles is required to get better results. Combining treatment modalities for better results. This is very important. So if you have another available methods, you can combine it. If you have a good device, you can also combine that one. So, but basically, filler and PDO threads are the most important part for deep forehead line corrections. Thank you. Thank you for listening my presentations. And we will have some questions and answers. Okay, can we use the longer thread and scaffold 21 gauge on 100 millimeter for the longer and wider wrinkles? Yes, of course, why not? But you should be aware that the longer the cannula, it becomes more difficult to handle it, especially when the forehead is convex. So it becomes more difficult to keep the same depth throughout the long wrinkle. So I would recommend to use rather 2 short or medium lengths, middle lengths of end scaffold to create a better result. Next question. Thank you for the speech. I have some question for the doctor. Can you re-talk about the techniques using in glabella wrinkles and forehead treatment? Which layer we will insert the needle in? Okay, you mean HA filler, right? Honestly, glabella wrinkles are very highly risky area to inject any filler. But if you know about your technique, and if you are sure about your technique keeping the needle intradermally, then I think we should use it to correct glabella lines or wrinkles. So the technique. So there are 3 techniques. I will summarize again. Okay, I'll focus on deep folds. First one is to inject and dissect simultaneously. So usually the deep fold, there is a hard or heavy fibrosis just beneath the dermis. So even if you are using a sharp needle, if you gently dissect, there is no bleeding. Or you can use lidocaine mixed with epinephrine before injection. It's up to you. So if you dissect the fibrotic tissue and inject simultaneously, then you will create a space for the filler location as well. So fibrous tissue dissection, and also you will create proper space for the injected filler. And second one is strut injection. That means if the fold is quite deep, and it's not usually enough to inject along the line. So injecting very small bolus injection, but perpendicularly to the line, then it's just like making many breaches, small breaches. If the deep fold is, assuming the deep fold is a river, small river, and you are making many small breaches. And then these injected fillers, bolus fillers, will support and will stretch the skin across the line. So it's quite effective, especially when the patient has very deep folds, folds like scar. And also, multi-layer injection is very important. So especially if the patient's skin is very thick, usually on the forehead or glabella, the skin is very thick, especially for men. So you can easily inject 2 or even 3 layers within the dermis. So I use soft one and softer one, just a superficial layer to the first one. You can also inject 3 layers if you are very expert. Okay, is there any question? Next question. Is it better when using needle than cannula in forehead lines? You mean filler injection? Absolutely, you should use needle, because basically a cannula cannot approach into the dermis. So even if you feel that your cannula is inside, I mean intradermally, but it's not. It is located just beneath the dermis, so it will be just immediately subdermal layer. So you cannot correct a superficial line if you use cannula, even if you use a 30 gauge cannula. So I would recommend to use a needle, but very carefully. Okay, next question. Can you share your experience in how to determine which layer of the skin that the needle is inserted in when we doing procedure? Layer of the skin. As I said previously, if you are not sure that your needle is located properly, then there's very easy way to verify your needle's location. You lift after advancing your needle intradermally, and then if you lift up the skin, you will see the color around your needle. If you don't see any change of the skin color, then that means the needle is located too deeply. So your needle may be located in subcutaneous layer, for example. When your needle is located in the mid-dermal layer, then you will see a whitish color change if you lift up the skin. And if you see a gray color, that means your needle is located too superficially, maybe into epidermis or very superficial dermis. So even if you are using very soft HA filler, you will make papules, and then you could have some lumps that last quite long. So it's not recommendable to inject too superficially. So if you see whitish color, that is a very optimal layer. If the wrinkle is shorter than 4 centimeters, do you cut short the thread before inserting or later or after? Okay, I'll say again about the product. End scaffold there are 3 types of end scaffold. So 10 centimeters, 9 centimeters, and 6 centimeters, right? Okay, so as it is folded in the middle, so the actual length will be the half. So 3 centimeters, 4.5 centimeters, and 5 centimeters. So shorter than 4 centimeters, you only have to use the shortest one. But if the length of the fold is less than 3 centimeters, then you should cut the remnant PDO threads. But it's not that difficult. If you stretch the skin, the remnant PDO threads will enter into the skin. So you squeeze the skin to the entry point direction, and then you will see a more amount of remnant PDO threads. Then you only have to cut just at the level of the entry point, and then you stretch the skin again. Then there will be no chance of the escaping of the PDO threads. Do you inject botulinum toxin to relax the frontal or glabellar muscles before the filler and the thread insertion, or only around the line area? Okay, when I use air toxin technique, it's not that I want to relax the muscle. If I use air toxin technique, then botulinum toxin's role will be resurfacing, rejuvenating the skin, because botulinum toxin has pore reduction and skin tightening effect when it is injected intradermally. So if you inject very superficially, very small amount of botulinum toxin on the forehead lines, it won't relax the patient's frontalis muscle, so there will be no ptosis. But if the patient has no chance of ptosis, then I inject botulinum toxin intramuscularly or subcutaneously, as usual. But usually I inject for the last sequence. I mean thread, HA filler, and then lastly I inject botulinum toxin. If I do all these treatments on the same day. But if you want to separate the treatment, for example, if you want to inject botulinum toxin first, and 2 weeks later you inject filler and PDO thread, and then botulinum toxin will be the first treatment, because it's separated, and you will have some benefits after botulinum toxin injection. But usually I do almost always I use all these treatments on the same day. So mostly I use botulinum toxin injection for the last sequence, last treatment. Is there any question? If we need combined treatment filler with thread, better inject filler first or thread first? Very good question. It may depend, but basically I insert thread first and then inject HA filler after, because after insertion of PDO thread and scaffold, then the filler amount may change than before treatment, than you expected. So for precise correction, it's because the thread will act as a scaffold. So the filler amount needed will be decreased generally. So for better and precise correction, it's better to inject HA filler after video thread insertion. Okay. How many threads is usually inserted for wrinkles? It depends on the length of the wrinkle. Usually I use, I think most forehead lines are around 3 to 5 centimeters long. So that's why I usually use one end scaffold, long or middle or short, any end scaffold, depending on the length of the fold. So I use one scaffold per one fold because, as I said earlier, even if the fold is very long, about 8 centimeters, let's say 8 centimeters, but if you see precisely, there will be a disruption in the middle. That means two folds are overlapped in the middle, then it may look like a long fold. So it's better to use two scaffolds approaching from each lateral side. And if the fold is connected in between, then you should insert end scaffold without any blank between two end scaffolds. So it should be a little overlapped. Do you understand? So if not, there will be some dent or depression in the middle. But if so, you can also correct using HA filler. Okay, we ran out of time, so I know that there are many questions, but maybe we can have some discussion next time. There will be some chance to meet. So thank you very much, and enjoy your afternoon, and see you next time. Thank you.